Hi, in this video I'd like to talk about amenorrhea, which is also a very common condition we see amongst pubescent and also women in their fertile periods. This is a very common condition, and amenorrhea simply means the absence of menses, or you're not menstruating for a certain duration. So amenorrhea can be separated into primary amenorrhea or secondary amenorrhea. So primary amenorrhea means you never menstruated ever once in your life. There was no history of menses, and even though you are at the age of 14 to 16 to 18, you are still not menstruating as per usual, and there are some underlying factors that are causing this. Secondary amenorrhea means that you have been menstruating before with a regular period as well, and suddenly because of certain underlying factors, you haven't been menstruating for a period of 6 months. So if you are surpassing or exceeding this duration of 6 months, it is most likely amenorrhea. So for this primary amenorrhea, the factors include maybe congenital factors, which means there could be an absence of a uterus, an absence of ovaries that are causing the lack of estrogen production that is causing this primary amenorrhea. There are of course other factors such as hypothalamic factors, which means hypothalamus is not secreting enough gonadotrophins, endocrine factors, anatomical factors, or even your diet or exercise habits can also play an important role in this. So diagnosis is very key. For secondary amenorrhea, it is quite similar, but there is no congenital absence of any organs. So we will only look at your endocrine, your hormonal levels. Are there any abnormalities in your reproductive system? And also we will look at your lifestyle, your diet, and also your exercise habits, because excessive dieting and also excessive sports habits can lead to amenorrhea because of the low body fat percentage that you will be having during this period, which will affect your ovulation as well. So diagnosis is that we will need to do a physical exam of your genitalia, and also we will need to do ultrasound of the uterus to figure out are there any anatomical problems, and then we will also probably need to do an MRI to take a look at your hypothalamic function to make sure is it the actual cause of your amenorrhea. So as a rule of thumb, when we see patients with amenorrhea, first of all we will let them do a pregnancy test, especially those of secondary amenorrhea, because in many cases when patients come in, when they say they haven't been menstruating for a long time, it's most likely that they are pregnant and they are just not aware. Now, we've already seen many cases, even recently, where patients will think that they have some problem, when in reality they are just pregnant. So pregnancy test kit is the first test that we will do to eliminate the factor that you're pregnant, and afterwards we will then systemically diagnose you as to what's exactly the cause, and then treatment will be then done according to the factor. If it is anatomical, we will be using surgical treatment to fix the abnormality. If it's a hormonal problem, we will need to do maybe supplementary or even surgery as well. At the end of the day, this condition is very easily treatable as long as you find it, diagnose it soon enough, and also receive treatment quickly. To find out more information about this amenorrhea, primary or secondary, please visit our website. If you have any questions, please leave them down in the comments below.